guys, it's Megan and Lindsay. We're going to kind of discuss and elaborate more on the blog post Runners from a Physical Therapist's Eyes. That was a more personal experience type of blog post. It was kind of my personal, I guess, journey with running when I was in college, and it was one of those things that I started just for general maintenance of weight and stress relief, and it eventually grew into more of a passion that involved nutrition, speed, intensity, duration, and frequency of running, to the point where I was training for a marathon fairly quickly during that journey. So since then I've stopped, but not necessarily because of any sort of reason, so much as I've tried other options and have been doing a lot more full body approaches to maintenance and health and nutrition. But it's a common, population that we work with, so we figured we kind of delve into why we like runners and why they are often a challenge from our clinical experience, right?
Yes.
Yeah, okay.
Yeah. I would say they're probably one of the more challenging groups of people of all the activities that we see.
Mm-hmm.
That and triathletes, which I feel is quite similar.
Yeah.
But they become a little bit of like a problem child.
Yeah.
In a nice way.
Yeah. Yeah, we've all been there. I think we find that what's difficult with some runners is when they are injured, when they're running, we oftentimes, not always, recommend that they scale back a little bit or stop running temporarily. And that is very often not well received. Some people are interested and they're motivated to do whatever they can to get back, but more often than not, most people don't want to stop at all, but they still want to run. So that's where things get a little dicey, right?
Yeah, and I think that it's such a huge point of contention sometimes with people that they actually stop care. And it's not even just so much stop running as it is like giving them an actual diagnosis. I've had people who I'm like, I think you need imaging, I'm concerned about X, Y, and Z, and they won't even do that because they know it might entail them pausing the running or cutting back a little bit. And it's I think to Meg's point in her blog, right, sometimes you're starting to get so much of the drive that you're kind of missing out on some of the benefits of the running and really setting yourself up into a position where you have a high risk of injury, a high risk of complications from injury because you're not able to scale it back. Because I don't think it's unreasonable to tell someone, hey, your activity is causing this problem, you need to cut it back or you need to stop it so that we can help you. And a lot of times that's just an absolute no-go, so it becomes kind of like psychological. Why can't you stop?
Right. And from my personal experience, from the surface it sounds like, I don't want to stop running because I just don't want to lose, my stress relief, which stress relief is critical for some people, especially in the working class. And the hard part is identifying why people are unable to be open to scaling back. There's got to be something that is preventing them, and oftentimes it's a personal reason. We don't always know what the barrier is, but I think finding ways to identify this in yourself as to why someone might be so resistant to stopping that one exercise is where things get challenging. And I think that that's where healthcare is beautiful, is that there's a lot of facets to what we have to deal with and work with people, but it's also a challenge in of itself because we can't always help the physical unless we address some of the more personal and the mental and the psychological approaches too.
Yeah, I mean, I think the last video and blog we talked about more of the structural, like, you need to be able to look like this when you do this, and this is more talking about the other components that it plays such a huge factor, and I think that's so important when we're talking about someone being successful in an activity or injury-free or recovering well, any of the above, is you've got to be able to address all the components simultaneously, and if you don't, that's where you're going to start seeing limited success. Some of those bits and pieces are going to be what holds you back, and the psychological component is so huge, and it's what drives you to do your activity, but it's also what drives you to be compliant with the things that we give you if you're really fighting us, and that's a big role, and how you interact with us. Are you going to be honest with us if we tell you we want you to cut back, but you're not actually doing that and you don't tell us? You know, so there's so many components to that, and really affects our relationship with the patient and how we can progress with their care. So it becomes very complicated, and I think something that a lot of people overlook. They don't really think it's important, but it's actually huge.
Yeah, it is critical, and we want to know those details because we want to help you get past those barriers, or at least guide you in the direction to help you get past some of those barriers. And so, I mean, there's no necessarily one rule of thumb on how to figure out these issues or these barriers, but you know, if something that you're doing is really exciting to you and you're enjoying it, there's a point where, you know, you might need to consider, okay, this is becoming a pretty regular routine in my life, you know, at least get ahead of it. Try to get to see someone that's going to help you prevent potential injuries or see possible problem areas before they become an issue. That way you can at least get ahead of any sort of, you know, restrictions on this new passion that you have.
Right? Yeah. Like, educate yourself, right?
Yeah.
What do you need to be able to do in order to perform this activity well, right? Is there any kind of movement prep, shoes, right, with running, or other equipment if you're doing another activity, nutrition, and you know, things like that. What's your training look like? Because the other thing too is the overtraining, right? You're driven so much that you're doing so much physical activity that you may actually be doing it fine, but you're just overtraining, right? So that's another part of the kind of psychological piece of that. But I think overall it's just something that shouldn't be overlooked.
Yeah, I would look into it, kind of do some, you know, retrospective thinking of what's going on, and then also be proactive in preventing these potential barriers. I think that's a big thing, and you know, we're always open to seeing people for these preventative measures, and we're happy to do so, right?
Yeah, absolutely.
So, I mean, if there's anything, you know, you can take away, it's just be preventative, be proactive, but also kind of think about why you're doing things and why it's important to you. And, you know, if you have any questions, feel free to shoot us an email, or if you have inquiries about, you know, how you can get past some certain things, we're happy to help.
Yeah, absolutely.